Welcome to Beyond the Mirror podcast. It's absolute pleasure to introduce today's guest, Dr. Lisa Godfrey. Lisa is a friend of mine and we have known each other for, I think, nearly 7-8 years now.
Yeah, at least I'd say. Yeah.
Lisa is a dental surgeon by background, specializing in facial aesthetics, has a thriving clinic, and what I always admire about Lisa is her enthusiasm and commitment to learning. You have done so many master's degree, postgraduate training. It's just inspirational. So Lisa, it's absolute pleasure to have you, and I think you will have a lot of expertise and good advice to share with our viewers.
Thank you for having me.
So Lisa, can you please tell us about how did you start your journey in medical aesthetics?
I started by my patients requesting treatments from me. At that time, I was doing prosthodontics. That was my first master's degree. And I used to use toxin for bruxism, TMJ problems, headaches, functional issues mainly. And my patients were, can you do it for cosmetic reasons as well? Because I already look and feel better when you're doing it the way you're doing it, but we'd like you to expand. And I was very much like, oh, no, I'm not that type of dentist. I'm treating you functionally. But they gradually talked me around and I started my journey then doing cosmetic toxin. And that journey now has taken me a complete reversal. I don't do any dentistry. I'm just all aesthetics.
And some people take absolute plunge and leave security of employed position, start their business. How it was for you? Did you build it gradually? Did you took the risk? And how did it feel?
So I did it gradually because I was still had the ability to treat my dental patients alongside growing my aesthetics practice. And I suppose as dentists, you're the same. You have a willing audience. They're interested in what you're doing. So I suppose in some ways it was a bit easier for me to transition and grow that side of my business. I admire people who completely take the plunge and just go all out and just start from scratch. But I'd say I was much more comfortable building it that way. So when I did eventually stop my clinical practice in dentistry, I had my patient base for aesthetics to work with.
And how did your friends and family felt? Did they support your change in your career, or did they doubt you?
My dad always doubts me. He's like, oh, you've done all that training. But no, generally my friends and family are very supportive. Understand that if you have a particular interest in an area of your work that really kind of ignites your passion and enthusiasm, then really that should be what you do. And for me, it's much more than a job. It's like a lifestyle thing as well, but also, as you say, I study a lot. I am very enthusiastic about the treatments that I provide. And I think that passion and enthusiasm carries across to patients. And so they're then more willing to, see you for treatments and things because they see that passion.
That is incredible. I think when you work with passion, when you love what you do, it makes such a huge difference.
Yeah.
So would you say you can confidently say that you don't work a day in your life because you love what you do?
I was actually speaking to somebody the other day and I was delivering some training, and one of the representatives from the company said, oh, you've changed your presentation again. But I change it all the time depending upon papers that I've read. And I was just explaining to them that I probably read maybe 5 clinical papers a day, and I do it when things like when I'm walking the dogs, or, when I'm doing some exercise. I read or I listen to things all the time. because I want to expand my knowledge and because I'm passionate about it. And so, as you say, I don't work, it's just my enjoyment.
Wow, 5 clinical papers a day, that is incredible. I think publishers need to hurry up to publish more. I'm sure everything that is available, you probably manage already to discover and research.
Not quite, but I think because I'm so, because now I've obviously done so many degrees, I can kind of, quickly pick out the good papers, quickly discard the ones that aren't very meaningful and I won't get meaningful data from. So it's kind of a quicker process now, I'd say.
I think that is a very excellent experience to share. And I think one of the points, if medical professionals watching that, is importance of continue, grow, develop, and never stop learning. That is what I suppose make you to stand out and make your practice to thrive.
Yeah, I agree with that because, you also, things change, and patients, have easy access to the internet and they're aware of trends changing. And are quite up on their knowledge about things, and certainly you probably find the same, especially in the wellness sector now. There's so much research and innovation ongoing, and I think one of the biggest breakthroughs has probably been in women's health.
Absolutely.
And that is massive. Thankfully now we're not being treated as little men. We're actually having our own science and research behind our health, and that's kind of exploded now within the whole remit of aesthetic medicine. And I think if you're not on top of your game with knowing about things like that as well, then you're kind of left behind.
Oh, absolutely. Talking about the trends and treatments changing, research going deeper, and new things always come out. So do you have any favorite treatment yourself to perform or to have?
Definitely exosome treatments have really been a game changer for me over the last couple of years. Just because of the way of the conditions that I can treat without being invasive for patients, but they're also a consistent treatment. So unlike things, for example, such as PRP or platelet-rich plasma, which rely ultimately on the health of the host, the person having the treatment, it takes away that kind of inconsistency in treatments, I'd say. Plus, it's a much more targeted delivery of necessary ingredients like growth factors, proteins, cytokines to the tissues that need it to help with regeneration at a cellular level. So that for me has been massive, I'd say.
I was listening recently to one podcast about regenerative medicine and treatments, and they're implementing this not only in aesthetics, they widely use in sports and exercise medicine, they use to treat it professional athletes. And was interesting point that doctor brought that with PRP, we need to perform a blood test before we actually carry on the treatment and detail medical history and age of the patient. What is your position on that?
Yeah, I completely agree with that because even if somebody's had an illness or it's the winter and they might be deficient in things like vitamin D or have low iron, if those things kind of like go against the treatment themselves because the quality of the plasma and the platelets won't be as good. Things like stress will have an impact. So I do agree, when I first started or entered the arena of regenerative medicine, it was the only thing that was around was PRP then. And interestingly, the people that I tended to not have the results that I would expect would be low in vitamin D, magnesium, ferritin, their platelet count might not be as high as you'd expect. So, it would really come down to we'd be looking after the fact, whereas now we're a bit more proactive. And if patients want those sort of treatments, then we do offer blood testing just to check that their baseline levels are fine to go ahead.
That's, I think, a very good practice.
Yeah.
So, Lisa, we talk about how aesthetic changing, but I still see that all sectors of medical aesthetics, regenerative medicine, skin health seems to be growing, and this industry is booming. Do you think there will be an end in the popularity of this treatment? Has it reached its peak yet, or do you think there is still opportunity to grow?
I think there's definitely still opportunity to grow. I think as treatments become more accessible and available for patients, and I don't just mean, having filler and toxin. Again, I'm referring to the whole wellness aspect within the aesthetic space. I think, as we gain more insight into our own health and how we can take charge of our health span. So, without having to rely on medication, but live a healthier life for longer. And I think that's where we'll see more growth in treatments, and complementing that alongside will be things like, looking after skin health, things like regenerative treatments such as exosomes. But also, in addition to that, we'll always need, traditional type treatments as well, like toxin and fillers, because they help obviously in, addressing loss support and volume, addressing functional issues. Whereas I think the growth will be with complementary treatments.
I very much agree with you on that. And also, interestingly, I personally, like for many years, see toxin and filler as a part of overall wellness package, because I think the difference is how practitioner applies them.
Yes.
There is some practitioners who use it to cosmetic purpose and sometimes unnecessary or even dangerous purpose. When I think when it's applied correctly, it's play a huge role in regeneration and improvement of patient wellness
and confidence.
and confidence as well. Yes,
I agree.
absolutely. So what would be your advice to the practitioner who entering this thriving market of medical aesthetics? What will be the best way to build their clinic and to increase their patient numbers?
So social media, as we know, is, massive. And I would say kind of like get yourselves out there, get your face on something like Instagram, do videos. It doesn't have to be perfect. Don't wait for perfection or worry about how you come across. Be yourself, be natural, because you will resonate with people out there and they will be attracted to you as a practitioner because they like the way you are. So don't be something that you're not. Be yourself and, put yourself out there, out of your comfort zone. We've all been there.
We're only growing outside of comfort zone.
It's true. And just be yourself, I'd say. Be yourself.
And what will be your advice to the patient who thinking about cosmetic treatment but overwhelmed with all the information, all the research that they done on the internet, because sometimes it could be conflicting as well.
Yeah.
So what is the best way to find your practitioner who will guide you, who will be honest, and who will understand you and give you the results that you want?
So again, see on social media who you might resonate with as a person and as a practitioner. Somebody you think, I feel comfortable with that person. Don't necessarily rush into treatment. Don't jump into treatment. Have consultations. I'm sure you're the same, but I have consultations for my patients and prospective patients. I don't want them to jump straight into treatment. That's a big red flag for me. If, a practitioner is offering straight to treatment on the same day if you've never met somebody. So I think it's really important to have that consultation, see whether you've got a rapport with that practitioner, whether they're listening to your concerns and your needs, and if they're understanding what your wishes are. and what you wish to achieve. Also, when you're at that consultation, are they educating you? Are they educating you about the aging process, about what's going on? What you're seeing from an external point of view, are they able to explain why that's happening, how to address the outward signs of aging, rather than trying to sell you like a package or one syringe of filler will do this bit, that kind of educational process I think is really, really important.
And also, I would say highlighting risks and side effects.
Yeah, exactly.
Because
Yeah.
each procedure comes with certain risks,
Yeah.
some more risky, some less risky, and you need to be informed to make to make the right choices.
Yeah, absolutely.
And Lisa, I know you're a workaholic because I'm the same, because we love so much what we do.
Yeah.
But can we dive in a little bit more? And if you share, how many hours have you put to start with when you just were building your career as a medical aesthetic practitioner? And how has it changed now?
So I was working 7 days a week, clinically, trying to manage my dental side of my practice as well as building the aesthetic side. I used to travel to London to work 2 days a week. Had my own clinic up here, and I would also try and fit in teaching. We met through that, and the reason why I used to like teaching so much, and still do, is not just imparting that knowledge and shaping minds, but also because the teacher makes the best student. So I'm always learning from that aspect as well. And so to begin with, it was definitely 7 days a week, quite full on. And now, we just said we're not working when we enjoy what we do. So that's difficult to say. I mean, I told you about my crazy week last week, flying back and forth to Ireland and working in between. But now, I can choose to work as much or as little as I want. So if I need to be around to do things with my family, then I can choose 3 days a week, or I can choose 5 days a week, or just it depends. And I really I love that I've got that flexibility and freedom to do that now.
That is, I think, amazing point, because I think that is something that as even self-employed physician or employed physician, you never have.
Yeah.
I think that is the whole purpose, to build your own business that can give you flexibility, and also you are in charge.
Yeah.
So that's excellent.
That's what I love.
And did you have a mentor through your career in aesthetics? I know you are a mentor for many practitioners out there, but at the beginning, or maybe through your career, have you had someone who were a mentor for you?
So at the beginning, no, because it was still relatively new way back when I was doing aesthetics, and certainly there weren't many dentists at that time doing aesthetic treatments. I'd say as I've progressed through my career, and when I was doing my second master's, which was in aesthetic medicine, certainly one of the doctors who was on that course, who was very experienced, I learned a lot from him, took a lot of his advice, and that was really useful, actually.
And would you say having a mentor is important for practitioners who start their career, want to shape it, maybe have some questions that they want to address, improve their practice?
Yeah, definitely. And I think if I'd had a mentor at the beginning, I probably wouldn't have not wasted time as such, because it's all a learning experience, but certainly from the aspect of consolidating knowledge, consolidating skills. Don't try and do everything too quickly. Really hone your skills in a particular area, then move on to the next thing. Because I think sometimes, especially now, we've just said there's so many available treatments for people to access now. It's important to not get too carried away early on, and get lost in kind of the noise of everything that's out there.
Oh, absolutely. And Lisa, this is a question that I ask all my guests. Do you believe that correctly prescribe and perform medical aesthetic treatment has impact on patients that go beyond the mirror?
Oh, definitely. Certainly, I know from my demographic of patients, the confidence boost for people is just amazing. Just that feeling that, especially as we get older and approach the perimenopause and the menopause, so many things change, physiologically for females that, you can kind of feel a little bit lost. And I think by empowering women to take charge of their health and wellness, whether that be through aesthetic treatments, we help to support them through that journey, certainly has a massive impact on confidence.
Amazing. And is there anything that you wish you have learned earlier in your career?
Just don't be afraid to step out of your comfort zone. And just, have the confidence to, put yourself out there and, introduce yourself to people, networking opportunities, that kind of thing, because there are so many people that can help and support you along your journey.
Amazing. And Lisa, where people can find more information about you, how they can connect with you?
So they can look me up on Instagram, Dr. Lisa Dinley, or find me at the Castle Clinic in Beeston.
And Lisa, it has been absolute pleasure. Thank you very much for sharing your insights and very inspiring career of medical aesthetics.
Oh, no, thank you for having me.
Thank you.